Today on Face the Nation, the weather outside is frightful, but Democrats found yesterday delightful as they claimed victory in the debate on health care reform. But as they claimed the 60 votes needed to pass health care reform in the Senate, Democrats called it a historic moment for America. Republicans said it was worse than the weather.
This bill is a legislative train wreck.
We'll go through what's actually in the proposal and get all sides, from Republican Senators Olympia Snowe and Lamar Alexander, and Democratic Senators Mary Landrieu and Sherrod Brown. Then I'll have a final thought on Washington's big snow job. But first, health care reform, a real cure or just bitter medicine, on Face the Nation.
Face the Nation with CBS News Chief Washington Correspondent Bob Schieffer. And now from Washington, Bob Schieffer.
And good morning again from snowbound Washington, where we got nearly 2 feet of snow yesterday as the Senate Democratic leaders were claiming that they finally had the vote of Senator Ben Nelson of Nebraska, and that gave them the 60 votes they need to pass health care reform in the Senate. Final vote now scheduled to come at 7 p.m. on Christmas Eve. The bill is massive, more than 2,000 pages. Basically, it extends insurance coverage to 31 million Americans who are not now covered. It creates nonprofit insurance exchanges where people can purchase insurance, and it does not include the so-called public option, that is a government-run plan similar to Medicare. The cost, an estimated $871 billion over the next decade. This bill also tightens restrictions on funding for abortion. It has many other provisions, including barring insurance companies from denying coverage to people with pre-existing conditions. It will be paid for by new taxes on employers who provide health care, by various fees on medical services and procedures, and taxes on some high-cost plans themselves. All our guests are in the studio with us this morning. We begin with Republican Senator, and appropriately enough, Senator Olympia Snowe, who's with us this morning. She was believed to be the most likely Republican to vote for this bill. In the end, Senator, you decided not to vote for it. Thank you for joining us this morning. Why, in the end, did you decide you couldn't do it?
Well, Bob, at this point anyways, I deeply regret that because frankly, I've been fully immersed in this process for a better part of the year, both my staff and myself, because I'm committed to healthcare reform. I believe that the current situation is unacceptable and unconscionable when you think about rising healthcare costs, and that's why, as the only Republican on the Finance Committee, I voted for legislation. I did have some problems with that particular legislation, but I said at the time the credibility of the process going forward would determine the credibility of the outcome. So here we are today with a bill that's dramatically different, more expansive than the Finance Committee. In fact, it's 1,200 pages more than the Finance Committee legislation. It was placed on the floor just short of 3 weeks ago, 400 amendments, and only 24 have been considered or voted upon. And 400 amendments are not unusual, since each of the committees that have considered the legislation have had more than 500 amendments. Then, less than 24 hours yesterday, we get a 400-page amendment that was filed by the Senate Majority Leader. We are scheduled to vote on that major amendment 15 hours from now at 1 o'clock in the morning, with no opportunity to amend it. All to get done, the entire bill, with no opportunity to amend it, to change it by Christmas, so that we can adjourn for a 3-week recess for a bill that doesn't become implemented until 2014.
Well, what was the tipping point for you? What was it that happened that made you say, I just can't do it?
Well, I sorted through a number of issues. I have been in countless meetings, meetings and telephone calls, meetings with the president, meeting with the majority leader, a number of people across the aisle, without question. The problem is the bill became bigger. It has the Class Act, which is a whole new entitlement that frankly will turn in the red 5 years after the benefits begin.
Now, what is that?
It's for long-term care insurance. And it's a whole new entitlement. In fact, half of those revenues that will be set aside for a vesting period will be used to calculate the deficit reduction over the next 10 years. That's where they derive half of their deficit reduction. Then you have a whole new layer of taxes. the Medicare payroll tax. And we have good tax subsidies, and I applaud Senator Landrieu that you'll be hearing from in a moment on those tax subsidies for small businesses. But on the other hand, you have a 1% Medicare payroll tax on small businesses, affecting them disproportionately at a time we're depending on them to create jobs to lead us out of this recession. It's not indexed for inflation. It's a 62% increase. So this will be devastating for small business as well. I have submitted a CBO letter on December 3rd with substantial questions on what is the premium cost for every American who will be participating in the exchange. What can they expect? If they're sitting around their kitchen table, they expect certain answers to certain questions. We don't have those answers to those questions, and that's why I indicated to hold off. I said to the President, and I said to the Senate Majority Leader and others, please give us the time. Come back after the new year, get together. This is a generational issue that has substantial effects with, in fact, I would say sweeping effects, because you're recalculating 1/6 of our economy. And frankly, we're treating it as if it's a legislative appropriations at the end of the year. It's like the last train leaving the station. We're going to dump everything in there. Let
me ask you this. It's my understanding that even after Leader Reid announced that he had the 60th vote, the 60 votes he needs, you met again with President Obama. What was that about?
Correct. The President, and I have worked together on this issue, and I applaud him for, his knowledge, his grasp of the issue. It's his major and highest domestic initiative on this issue, and he wants to get it done this year, and encouraging me to support the legislation. And as I indicated to him, I'll continue to work through a House and Senate conference, but the legislation that is pending, this process denies us the ability to thoroughly and carefully and deliberately evaluate what is at stake. I mean, we're talking about reordering $33 trillion over the next 10 years.
Was the reason for this meeting, was he asking you to vote for this thing when it comes out of conference? Is that what it was?
The pending legislation.
But you told him you couldn't.
That I had problems because the process is denying me and others, for that matter, the opportunity to amend it on a big bill. Why Christmas is not? There's no magic deadline. This beat the clock is really overruling legislative sanity.
Let me ask you about the abortion language in here. Senator Nelson insisted that the abortion language be tightened on what money could be spent on abortions in these insurance policies. But now he's satisfied, but now the Right to Life folks, the anti-abortion people, say they're not satisfied with it. But the people who favor abortion say they're not satisfied with it either. How do you feel about that?
Well, I helped to work on the underlying legislation and the provision that basically, embrace the status quo, making sure that we're not using any federal funds to finance abortion, using a precedent that's already exists in domestic family planning programs, international family planning programs, as well as Medicaid. I think there's 17 states that separate their funds. They're not commingled. That is a process that's worked time and again. And I think it's regrettable that it's reached this point with respect to this issue, because clearly what is in the current legislation should have satisfied those concerns. It was every attempt to write it as it is an existing law that would not use any federal funds to finance abortion.
All right. Senator Snowe, thank you very much for coming in on a very snowy day here in Washington. We'll be right back.
Thank you, Bob.
Thank you. Thank you, Senator. And we're back now with Democratic Senator Mary Landrieu from Louisiana, Ohio Senator Sherrod Brown, and Republican Lamar Alexander from Tennessee. Well, you heard Senator Snowe. She was one of those, Senator Brown, who was very much, almost really wanted to vote for something here, and in the end just couldn't bring herself to do it. You were one of those who very much wanted a lot more than what's in this bill, in the sense you wanted a public option. You said you're going to vote for it, but are you happy with it?
I'm disappointed. I think it could be a better bill, but we're making major progress in this bill. I mean, first of all, for those people who have insurance in this country, Right now, you're paying more than You're paying $100 a month, more than $1,000 a year, a hidden tax for basically for care for people who don't have insurance, to go to emergency rooms and all that. This bill's got good insurance reform. It says that no more pre-existing condition, no more exclusions for that, no more discrimination, women paying more for health insurance than men. It strengthens Medicare. It provides free screenings for Medicare for every Medicare beneficiary. It lengthens the life expectancy of Medicare. And it gives tax breaks for small business. And those start immediately so small companies can begin to insure their employees. Most companies that in Cincinnati and Cleveland and Columbus that I talk to want to insure their employees. They simply can't afford it. If they have 20 employees, one of them gets cancer, it makes their premiums unaffordable. So this bill moves absolutely in the right direction.
Are you convinced people are going to pay less, that this is going to reduce costs?
I know what
I keep hearing people say it's going to cost a lot more.
This bill, if we do nothing, insurance premiums are going to double. You know, I'm amazed as I hear Republican after Republican take to the Senate floor and defend the insurance companies, practices worthy of Ebenezer Scrooge. And the way they'd have it is that the insurance companies would cancel Tiny Tim for pre-existing condition. I mean, it's clearly not sustainable what we're doing now. We clearly need to go on a different path.
So, Senator Alexander, as a Republican, I take it you don't quite agree with that, but let me ask you this. Republicans have done everything they can, and openly, they're not making any secret of it, to slow this process down as much as they can. Is it now done, or will you continue to try to slow this vote down?
Well, no, it's never done in the Senate until it's done. And I thought Senator Snowe pretty eloquently explained why we want to know more about the bill. I mean, there's a reason why we're voting on it in the middle of the night. We just learned about it yesterday. They're trying to push it through before Christmas. There's a lot of explaining to do. I mean, how are you going to help Medicare by taking $1 trillion out of Medicare over a 10-year period at a time when Medicare is going broke in 5 years according to its trustees? How will taxes help create new jobs when we've got 10% unemployment? How are governors going to pay for the Medicaid expansion? Almost all of them are saying they'll have to raise state taxes, they'll have to raise college tuitions. And then what about the 16 million Americans, low income, who are getting dumped into Medicaid, the program for low income Americans, where 50% of the doctors won't even see new Medicaid patients?
So let me get back to the question.
So there's a lot of explaining to do.
Let me get back to the question I asked you. Are you going to continue to try to slow this process down, or are you going to let it come to a vote?
Well, we want to take the time to let the American people know what it costs, what it is, how it affects them, because we believe when they find out, they won't like it any better than they do now, and they won't allow Congress to pass it.
Do you believe it is possible to keep this from coming to a vote before Christmas?
I'm not sure. We'll have to see. But it is outrageous in the middle of a snowstorm to give us a 2,700-page bill yesterday, start voting literally in the middle of the night, and say, let's pass it before we go home for Christmas.
Senator Landrieu, you were one of those like Senator Snowe who was very much on the fence. But then somehow in what people are calling the Louisiana Purchase, $300 million in Medicaid help for your state came your way, and you suddenly were able to vote for this.
Bob, let me be very clear. Nothing could make me vote for a bill if I didn't think it was the right thing to do for my state and for the nation. Nothing, no amount of money. That was one of about 12 things that I fought very hard for, and I'm pleased to say in the final bill, many of them have presented themselves. One, Sherrod mentioned tax credits for small businesses. I'm the chair of the Small Business Committee. I was not going to support a bill that didn't have robust help for small business. I was not going to support a bill that had a small business mandate. So there were a number of things. That was just one. And it was a very worthy request in the sense that after Katrina, our calculation for Medicaid put us in the same category as Connecticut. People know that Connecticut is a much richer state than Louisiana. But having said that, I'd like to answer the question you asked Lamar. There's only one reason we're going to be here till Christmas, and that's Senator Tom Colburn. We don't have to vote in the middle of the night, but he's the one making us do it, not Harry Reid, not the Democrats. It is a Republican obstructionists that are making us vote in the middle of the night. Number two, we've been discussing this issue for 40 years, not 4 months, not 4 weeks. 40 years we've debated this. And since last March, this discussion has been public. So this business about they don't know what's in the bill, it's been widely distributed. The language has been on the internet. We are going to get this done before Christmas, and it's extraordinary that Democrats, Sherrod, who started out for a robust public option, I was not necessarily for that much government involvement, have come together to write what we think is a great, very good, great bill for the American people.
The assistant Democratic leader, Dick Durbin, said on the floor last week he didn't know what was in the bill. We got a 400-page amendment yesterday. The reason they're rushing it is because they don't want people to know about the Medicare cuts, the tax increases, and the chief actuary of government has said that rather than decreasing costs, it will raise costs over the next 20 years. That's the chief actuary of government in the Obama administration said that.
Let me put a human face on this. In Toledo and Dayton and Piqua, Ohio, 390 people every single day are losing their health insurance. 390 people a day. Across this country, 1,000 people a week die because they don't have health insurance. A woman with breast cancer is 40% more likely to die if she doesn't have insurance than if she does have insurance. 40% more likely. So this kind of obstruction, I mean, this gang of six started meeting formally in June, but much before that, as they started negotiating this bill. Everybody knows the great majority of what's in this. Everybody's debated it. Everybody is, and it's just a question of delay. I mean, in the end, and I like Lamar and I like most of my colleagues on the other side of the aisle, but it's so much what the insurance industry wants. The insurance industry stands to lose a lot. CEO of Aetna made $24 million last year under this bill because we've got a provision in this bill that no more than 15 or 20% of every premium dollar can go to the insurance companies. The rest have to go to hospitals and doctors in Knoxville and in Baton Rouge and in Columbus.
The fact
so
of the matter,
that means that insurance companies are going to come to the table and going to have to give a little bit up.
Sherrod Brown or any other person explain to me how you're going to take $1 trillion out of the Medicare program on which 40 million seniors depend, which is precisely the amount when the program is fully implemented, and not spend it on Medicare, not spend it on grandma, but spend it on somebody else. That's
all right.
At a time when the program is going broke in 5 years.
First of all, we don't take $1 trillion out of Medicare. We take a couple of $100 million by streamlining the program.
Now, Mary, if the CBO says it's $1 trillion over 10 years when fully implemented.
It is not $1 trillion over time, and Republicans like John McCain and Lamar Alexander have supported many of those same ways to streamline Medicare in the past. John McCain actually ran on some of this. So to claim that we're doing something that Republicans and Democrats haven't tried to do for Medicare, we're strengthening Medicare. That's the bottom line. 7 years expanding that trust fund, and we're taking some of that money and providing tax cuts and tax credits for small business. And for the first time in America, Americans will have an opportunity to have the same kind of insurance that federal employees have, including members of Congress. That's a promise the president made, and we're keeping it.
And the AARP and the American Medical Association wouldn't be supporting this bill if it were
Right.
substantially cutting Medicare. Most of the cuts, the reason, when you throw a rock into a pack of dogs, the one that howls is the one you hit. And most of the people, the reason that the Republicans are howling on the Medicare quote unquote cuts is because we're cutting insurance company subsidies that have gone to Medicare. So you take those subsidies out, of course they're unhappy with that because the insurance companies are their biggest supporters in election after election.
This is exactly why we shouldn't be voting in the middle of the night and passing at Christmas. They are saying that tax increases aren't tax increases. They're saying that $1 trillion cut in Medicare spent on a new program isn't $1 trillion cut in Medicare. They are ignoring the fact that they're dumping on states new expenses for Medicaid that in my state, our Democratic governor has said is the mother of all unfunded mandates, will cause tax increases and increases in college tuitions, and they're dumping 16 million low-income Americans into a Medicaid program, which 50% of the doctors in which they won't see new patients.
Bob, let me just add this. They're going to 94% of all Americans are now going to have health care. This is being done through a private-public partnership, not a government takeover, but reform of the insurance industry that people even have insurance are desperate for. And it is not being done, in a very quick way. As I said, we've been debating this all year. So we're ready to come to this great compromise that we believe that brought the Democratic Party together. We wish the Republicans would have joined us, but it's easy to be unified when the only word in your vocabulary is no. That's all they've been able to say to the American people. It's time to say yes to them and get on with the job of governing.
Let me tell you why this is no longer business as usual.
About 10 seconds.
Okay. In 2003, when the insurance companies and the drug companies and President Bush pushed through the Medicare privatization bill, they had they were not paying for it in any way. We are paying for this bill. Congressional Budget Office says it'll be over the next 20 years. It'll be a $1.4 trillion pay down of the national debt.
All
this
right.
is Congressional Budget
10
Office saying
seconds.
that.
Medicare
Alexander.
cuts, tax increases, big new taxes on states, and dumping low-income Americans into a Medicaid program where half the doctors won't see new patients.
We will continue this conversation. We're out of time. Back with some closing thoughts in a minute. Finally today, Washington woke up a different place yesterday. No, I don't mean elected officials suddenly put aside partisan games. No, Washington was, depending on how you look at it, the victim of or blessed by the ultimate cover-up. We were covered up by a huge snow. From the Capitol, where the Senate was locked in nasty debate, to the White House, Washington was transformed into a winter wonderland. That's the thing about snow. The cliches come tumbling down with the first flakes. We can't help ourselves. But even the torrent of words and descriptions we've heard a million times before can't beat the scenes that a snowfall paints. There's an old Washington truth, another cliche to be sure, that where we stand depends on where we sit. A snow just underlines that. Adults dread snow because it means school closings, snow drifts, detours, and blocked sidewalks. Children, on the other hand, love snow for exactly the same reasons. School closings, snow drifts, detours, and blocked sidewalks. Is that then a thought for the holiday season, that when we allow the inconveniences of modern life to overwhelm us, we miss what every child knows but can't really explain? That a change in the weather, the first snow, a sign of spring, a summer sunset, can make us smile and help us to find peace and contentment. Are there miracles? I believe snow can be a miracle, but only if we allow it to be. Back in a minute.